Yes. Yeah, I know, like almost every person I know. Affected by it.
Your goal is to check out.
Model that's a little.
Yes,
Yes, let's do that.
I work with senior volunteers.
You did? You? Nice.
I'm responsible.
Very good.
I think, you know. So it's one step, right? That's on me. I always. Apologize for showing up. There are very many people afraid to do that. How are you? You're out, that means how there.
Am I right? Yeah. Back in the little, other than that, good. Yeah.
Yeah, sure. People don't know that, so they're not.
Yes,
I'm a I didn't go through anything. And I called anyways. And I read something and I called for OT and. Well, I was trying to get stuff to find out. In it's hard. I mean. Yeah, let's save this person's life or whatever, yeah. Help.
Exactly.
Yeah, that's on our.
Yeah, that's by trouble.
Okay. All right. Good afternoon, everyone. Welcome to March 28th Regional Opioid Abatement Council Region 2 monthly meeting. It's 2 o'clock, so call to order. We do have a quorum of voting members. Only person missing is Trustee Mason from Wellington. Everyone else is here. Is that correct? All right, wonderful. So, and welcome everyone here to our meeting. We, as always, have a very full agenda with great work that we're doing. So we'll get going right into it. First, order of business is any public comment. Anybody like to make a comment of anything that's not on the agenda? Anyone online? TV will close public comment. We'll move to item 3, approval of February 22nd, 2024 meeting minutes. Any conversation or anything on a motion?
I'll make that motion unless there's any additions or changes from the body.
Jessica, we have a motion and a second. Any further conversation? What is that?
I have an amendment I'd like to minutes if I could. It was the part in there that said, Jessica Plummer will assist in the grant making and evaluation. I'd like to amend that to say Jessica Plummer offered to share VHS's grant tracking and evaluation processes and provide technical expertise as needed. I will amend my motion to include that exact language.
Do you accept?
Yes.
All right, we have a Motion with the amendment. You have that, right? And a second. Any further conversation? Hearing none. All those in favor?
Aye.
Anyone opposed? All right, hearing none, that approves with the friendly amendment. Thank you, Jessica. All right, moving to item 4, which is our fiscal and grant administration. Everyone, we've got a big packet here with lots of information. Before I turn it over to Carol and John, folks, these two worked their tails off since the last meeting to get all of the contracts and reports and all that's in here. A big thank you. I know it's a lot of work. I really appreciate your work, so thank you. With that, I'll turn it over to you two.
Okay. The first item is the quarterly financial report, and this is information only. We don't need a motion from the council. So you will see a Excel spreadsheet in your packet. And there it is on the board. Thank you, Bev. Very nice. This is where we are right now on our 2-year plan. So if you look to the far left-hand column, there's the categories of the revenues and the expenditures. And this is what we submitted to the state as far as what we were going to spend our funds on. So this matches the state plan. And then there are 3 sections going across. One is last year, one is this year through March, and then the last column is the total of both. That makes up our 2-year plan. So I want to just draw your attention to that last column. So there's the budget, which is our plan. There's what we actually spent or received to date. And as you can see, we asked for $5.5 million in revenue and we received about 3 million. We've been told that the rest of the money is coming. Hopefully it's coming soon. So hopefully in the next couple months, we'll get all of that revenue. And then you'll also see the actual expenditures that we made against each of the items. And then the amount that is allocated but hasn't been paid out. So that's for under our grant agreements, we're paying 50% up front and we're paying 50% at 6 months. So we've allocated the money for those agreements, but we won't pay it out yet. And then the last column is the unallocated piece. The first one, the 550, that is for criminal justice involved persons. And we have people from the sheriff's department here to make a proposal for that money. And then the next one down, the 400,000 is the supported housing, which the council sort of tentatively allocated to Harvest Farms pending some clarification about their expansion and what that might mean as far as the septic and all of that. And then the last 100 is under the school program section. And we have a proposal today from Rise Above, who will be looking at those monies. So that's where you are as far as what you've got, what you've allocated, what you've spent. Any questions about that?
Yes.
Thank you, Mr. Chair. First, let me echo our chair's comments. This is really a lot of work, and I appreciate all the work that you have done because we are kind of operating on a shoestring budget and capacity wise, and I just want to thank you both for this huge lift. And I know it comes with a very impeccable integrity because of all your department having 40-year track record of having the independent audit that says you're exemplary. Just know all of you are, this is really exemplary work, and I just want to thank you. And I want to just kind of reiterate that because it's really easy just to come in and have you present all this in hours. So first, my first comment is hoping that you're really tracking and accurately charging for the county, and because we're the fiscal agent, and it's I know you really believe in, but I'm sure we're accurate and making sure the county's getting for all the staff and your staff. I just want to not encourage you to be, say, oh, well, I'll just kind of brow down or say, I just really want to make sure we're getting those costs accurately reported. No, I know, I just know, sometimes it seems like it's less than, I know you guys are working. Secondly, you and I have been in those meetings, monthly learning forums, and I think it's been mentioned a couple of times that there's a little delay on some of these funds, and they said, well, you may not be able to, you might have to not pay some of your grantees, or because we don't have a budget. Can you just help the rest of the board? Because you and I have been in those meetings, and I don't know if people have gone back and watched, but could you just repeat what we heard from the AG's office, just a little, because I think we should have that on our radar, just first.
Yeah, the AG's office has told us how much money we have for this year, and we assume, because the way it worked last year, that we would have that money like in January. But it's trickling in from many different sources. And I think the last I heard was maybe we'd have it all by June. Is that how you heard it, or?
Yep, but I just wanted everyone to hear the same information. So I think you were probably registered that a little more accurately than I did. I just know, because there was just so much information. So I just wanted to kind of, if you could share that, so.
So what we ended up doing in our grant agreements for this year, it says half up front, half at 6 months, pending whether we actually have the money. So far, we've had enough money to make every payment on time, but it's in our agreement that there could be a delay if the council has not received the funds.
I appreciate you sharing that. I figured you had that a little bit more registered in your brain, because that's, you work dealing with these things. I appreciate you sharing. I just wanted the council to hear that from the learning forum from the COAC, so.
And they said also that this would be the way it is going forward in following years, that you're going to get the money, but you just don't know when. And so we have to kind of figure out how to juggle that cash flow piece as well as the grant piece.
Thank you. That's all I have. Thank you, Mr. Chair.
Any other? Thank you for welcome. Joining us there, Trustee Mason. We do have a full forum now. Any comments, questions online? Not seeing or hearing. We'll move to the next item on this portion, which is approval of the Colorado State University grant amendment.
Yes, last year, this year, this council approved CSU's proposal for $300,000, and that was approved at the January meeting. So in your packet is a amendment which amends last year's grant and provides the $300,000 for CSU this year. So what we're looking for on that amendment is an approval by the council.
With no further deliberation, this is no change from the previous presentation, just the amount. I would move for the approval as amended.
Second.
We have a motion and a second. Any further conversation? Seeing, hearing none, we'll go with the question. All those in favor?
Aye.
Is anybody opposed? Hearing none, that passes unanimously.
Turn it over to John Voss to talk about the new grants.
As you'll remember at the last meeting, we had 3 proposals and presentations where they talked. The Abundance Foundation, which is made an application for both social connectedness of 250 and the housing portion for 211 for a grand total of 461. They're mostly, most of their services are down in the Loveland area. The Denver Rescue Harvest Farm agreement, we split that out so that the social connectedness could move forward while the remodel could wait until the cost and other related issues to that project are resolved. And then lastly was Yarrow. They're also a new entity that presented, and their social connectedness, and For the most part, we're just on the last little issue on one of their insurance, but other than that, everybody is looked at the contract and provided the insurance certificates we need, with one little detail still to work out with the R.
All right. Anybody have any questions about any of these three new grants? I do have one, but I wanted to see if others have any others first. Brian, Abundance Foundation, the question, is he here? Did he explain, now maybe you know, he explained on page 34 of the packet, it indicates what I see a monthly stipend for rent, but then it's broken up into 3 months. The first month being 50%, month 2 being 25, month 3 being 25 to get to that $900. So is it $900 a month or is it $900 for 3 months? That's where I got that was confused.
I think it's per unit per month.
Per unit per month.
Right.
Okay.
Believe how Brian operates it, it would be essentially $900 per unit for 3 months. They do 50% of the rent the first month, 25% the 2 subsequent months, turning into a 1 whole month's rent over 3 months.
Okay.
I believe that's how.
That's how that's worded. Okay. All right. Thank you. Any other? Yes, ma'am.
I'm still a little confused though. So is it the 900 monthly?
What you just said, no,
Yeah,
it's the 900 over 3
over
months.
3 months per quarter.
50% of it on month 1.
Okay.
Well, it
Yes, the
does,
total rent is $995 per month per client, and then they pay first month $497, second month $248, third month $248.
Say that again. I think
Is
you're
that
probably
I
right.
believe that's correct.
Okay,
Yeah.
so say it again, please.
So the rent is $995 per month
Okay.
per client. The way that they subsidize that, they pay 50% the first month, which is $497.
Oh, okay.
Second month, they pay $248.75, and the same thing third month, $48.75.
So the person then pays 50% of that rent month, 75 second. Okay.
Mr. Chair, I have a comment.
Yes.
Thank you. Appreciate you. Wish I could be with you guys in person today. I may be late to the game here, and I might have should have asked this question at a different meeting, but I missed last month's. You know, from my experience, it's really hard for folks transitioning right out of treatment or incarceration. And for them to be, I mean, so the 900 isn't a scholarship for a free first month. It's they're still responsible for what I think 450, 495 above that. Personally, I would prefer that a person get a scholarship for the first month so that they can actually get, most folks don't have that amount of money to put down on housing the first month they're out released. So that's how I personally feel about it. I would rather it be the first month free for these funds.
Yes. Thank you, Vice Chair.
thank you, Counselor Black. Yeah, you know, when I read that and then I read the next sentence, it was kind of confusing. Correct me if I'm wrong, did we hear that during the presentation that was broke? I mean, I'm just trying to, because this seemed like it was new and I was reading the packet. I don't remember having that conversation when we were having the presentation. Can you correct
I
me-
don't remember either.
correct me wrong.
I don't remember either. And I did review the last meeting on YouTube, and I didn't remember hearing that. So when I read that, that's a huge barrier. They're going to miss folks being able to utilize that. That will lower their percentage of folks that they can help from the get-go right there.
Yeah, I would agree, Councilwoman Black, on that point. I believe that Brian's first presentation, he did bring up the structure of how they like to do their scholarships, and it's 50% and then the 25. I'm almost certain that was brought up here at one of our meetings. I don't think it was his presentation last month. I think it was his first presentation.
Thank you.
I also know that some of what they do, they get that other 50% subsidized from probation and parole often. But that doesn't account for those who are entangled in the legal system, obviously. So I think Counselor Black's point is really valid. I sent Brian a text letting him know the council has some questions to see if he can call in, so we'll see if there's a response.
Thank you for that. Any further questions, comments?
No, I too agree. Councilman Black. Because I think that first one is so crucial.
That was my question too, are they getting any help with other, like the current people? Are they getting any help with other agencies as they're moving?
So, Mr. Chair, in interest of our packed agenda and the time, I'm asking maybe we can pause this so we don't have the conversation, see if we get an answer. If not, it sounds like there's another concern about this that I just, knowing how busy we are today, I think this is important. There's enough folks and Counselor Black's comment is well taken. So I would make a motion that we pause and to see if we can pause this conversation and this action until the end of the meeting to see if we get an answer. And then at that time, we can maybe take a motion to further action. But right now, I'd like to make a motion to move this towards the end of the meeting.
I would second that.
We got a motion and a second regarding pausing this conversation. Any further conversation? Seeing, hearing none. All those in favor of the motion?
Aye.
Anybody opposed? That passes unanimously. All right, Denver Rescue, Harvest Farm, the Social Connection, and the Yarrow Collective. Any questions on those two? Yes, ma'am.
Forgive me, I've been reading so many pieces of legislation with the Colorado legislation and these packets this week. Did they add, I think I saw it, but can someone say that they saw that they were gonna amend to say they were gonna expand? And we had that conversation, they were gonna expand to other parts of Loveland or the county. I think they were gonna amend the agreement, remember that? Yeah.
I think they did.
Was that in there?
Yes.
Okay, that's all I wanted to
Thank you for that.
I remember it, I think I saw, but I just wanted to confirm that's good for me, thank you.
Yep. And that was to expand out to the southern part of the county.
Yeah,
Yes.
the southern part, yeah,
Yep, good question.
thank you.
We want to make sure we get this right. Any other questions, comments on those? Hearing none, want to make a motion?
I'll make a motion to approve the two contracts that we're looking at right now, for one for Harvest Farm for Social Connections and the other is Yarrow Collective.
I'll second that.
The motion is second. Any further conversation?
Kara pointed out, I forgot to bring up there, we had a question in one of the clauses about if they promote their program, there's a phrase in the contract that requires them to get prior approval about how they're giving the ROAC credit for funding the program, at least in part or in whole, and getting it in advance.
And a couple of the grantees
And a
had
couple
questions.
asked about it.
Yeah, what
How
does that
soon?
mean? How will that
How
work?
does that approval work? Who would approve it? It was taken on, and so I talked to Jessica when she got back, and she said they do it, and it turns around pretty quick for them. I don't know if the motivation or the reasons we want that in this clause, in the contract is the same.
Sure.
Yeah.
Sorry, I think it's important to have something in there. I don't want to create any barriers, but I think for them, for people, it's for education, understanding where the money's coming from to help with the folks to understand that this is part of the abatement and settlement. And also just to kind of help folks understand our involvement with that. And I think it's just also maybe a protection to make sure people aren't maybe using the region's endorsement without some of that, with us approving the letter and stuff. And I don't know if we want to look at a quicker system since I know that she has, she kind of looked over that for the policy, and I don't know how we would do a quick turnaround if there was a problem. usually this is something that they wouldn't be doing a lot or immediately, they could maybe do up front. So maybe we could leave it and then look back at amending if it becomes a barrier with that.
Yes.
You'd like me to weigh in what Cortez usually uses our logo or our name to use it in some of their written materials, and so we just provide those. So you have a standard phrase of how you'd like to refer to the Rhode Island dollars that you can provide to them. That would be an easy template that's already approved that would require you to look at it again. Their county logo, that's what you're using if there's a state, regional, we have a logo, then you can just provide that to them and since I mentioned use something else, then it can come to you for approval, but as long as they have a template to work from, that it's already been approved, then it doesn't need to necessarily get.
I should put this. That's beautiful. How about Liv and I work on get a template for the next meeting, so we all have it.
Cool, great.
Does that work? All right.
Okay,
Any further communication, or questions or comments? Hearing none, all those in favor of the motion, signal by aye. Anybody opposed? That passes unanimously. Okay, we do have our final first year written report from the Northern Colorado Health Network. Thank you. I'm saying I found this report to be very valuable. I really appreciate the data, like participant zip codes that tells us how many were from the county, the demographics, like 40% LGBTQIA, and then the questions were just fantastic on what went well, what could we improve, and how do you sustain this program in the future. So I just appreciate all the work that went into the final report templates. Yes.
Mr. Chair, I agree. And I'm really glad that, we had a big discussion about these questions. In the beginning, remember all that, and I think that's proven to be very valuable now that we've been in practice. And I do appreciate the tracking of zip codes. And I think this is something that I might bring up, Mr. Chair. I'm wondering, because DCA can be done, I know maybe Carol's never going to agree, but I'm wondering if we should add to some of our metrics for tracking for our grantees that they do kind of track either serving by zip code, so we can make sure who's being served. And with this housing as well, my concern is always that it's known that we're paying for housing. We might have some folks coming up from other zip codes and other jurisdictions, and it might be important for us to know that's happening and also be able to see if how we're serving the whole county or not. So I would like to see if my colleagues here on the council would like to add that to a something that we're, I hate to say tracking, but something that we're requesting so that we can have that data. And I think zip code would help us find out who they are, not who they are, but where they're from and how we're serving the whole county. And I'm hoping you all might consider that, and I'm not sure if that would be a big lift for us to add that into the agreements or the metrics. I'm just curious, and I'd like to see that if possible.
Yes.
Maybe I dreamt this, but I thought it was already in there. Is it, or did they just add this?
Each proposer put in how they would measure their performance and what their metrics were. This group didn't ask for any standard metrics, which is what I'm hearing that some of the groups are doing. They're saying, for every grant we give out, we want them to track these 5 things. And then that's built into the grant agreement. And we don't have that yet.
Okay.
Might have talked about it.
I think we did, but I don't think we've made any requirements. So this is one that I believe would be important because I'd like to, for a lot of reasons. And so I think.
Yeah, I think that's truthful. Then you make sure there's some sort of provision for those that may be unhoused. Don't have a solid zip code. Some way to ask, track where they're actually coming from,
Right. And I think that's a valid point. And I believe Shane, as you know, in the southern part of the county, they can use one of those locations that is they're being served at as their zip code or their place of mail, I think. Is that correct?
Yeah.
So they could use that.
Yeah.
So,
I think up here at Murphy Center, there's something similar as
Yep.
well.
which I'm going to here right after this meeting. So, so I don't know what you all think about that, and I don't know whether, it would be nice to have this kind of, at least this in place going forward, since we're awarding all these new contracts. So we get this data starting now for us to be looking at, as we're making this data dashboard and some things. So I know this is kind of last minute, and I hope the grantees don't mind. It seems to me that might be something easily, gained, so, yeah.
So I'm hearing, getting this on the next meeting, kind of a template on what metrics we'd like to see. Right now, we're approving the first year written report from Northern Colorado Health Network, but that, we want to make sure we talk about that or have something for next meeting to discuss.
Yes, and yes, we're approving that, but I wanted to see if we can have, a discussion or have it next, meeting or something, because I think this would be important to have this for these new approvals, and I think they're all in the room, so they kind of know this might be coming, but I think it might be nice for them to start gathering and tracking. I think it'd be really, I hate that word tracking, but I think it's, data gathering and analysis, I guess.
And what I've learned from a lot of people in the room, that veterans are not always tracked. So that's important to me.
And if I could add to that, Mr. Chair, back in October, part of our meeting, we had some information from the Healthy Kids survey responses, and what that showed was that our prescription pain medications were on the rise versus their white counterparts, especially with our youth. This was self-reported, and so I don't know if that's something we want to add to that conversation. We've got some high priorities that we already have data on, and I'm wondering if we would like to see data tracked on those specific demographics, because I would like to address that statistic. And so I would like to know if any of these programs are focusing on our Hispanic youth.
Sure, thank you.
Mr. Chair, I'd like to call the question, to go ahead and go back to that approval, and maybe we can continue this discussion when we have the update on the data and evaluation subcommittee. And maybe we can talk and make a motion to move for some kind of test for the next meeting. That would be okay.
Yes.
Thank you. So I will make a motion to approve that first year report unless other folks have further comments about it.
Got a motion. Thank you, trustee Mason. Any further conversation?
I just thought it was so very interesting and so much information. I just really appreciate the time that it took to put it together, and I think it'll be just valuable. I can't wait to see all of these come back and what we'll learn from it. So.
Thank you. Any further, all right, seeing none, all those in favor?
Aye.
Anybody opposed? Right, that passes unanimously. Thank you. Moving to the next agenda item, we've got the Larimer County Sheriff Office co-responder 2024 funding proposal. How you doing, sir? Good. Thanks, sir. Yes. Okay.
Good afternoon, Mr. Chair, members of the council, guests that are here. My name is Robert Cook. I am a sergeant with Larimer County Sheriff's Office. Also to you guys online, I want to say hello. Thank you very much for the opportunity to present to you guys today. I know we have a packed agenda, so I'm going to try to be informative, but also very quick. So first of all, before we get started, I want to introduce a couple guests that I have with me today. First of all, Under Sheriff Joe Shellhammer, who's our operations chief for the sheriff's office, Lieutenant Jeff Van Hook, who's the oversight lieutenant for the co-responder program and the school resource officer program, and then Corporal Steve Fay, who is actually the person that we have put into the position as a result of last year's funding. So wanted to let you know that there are actually faces of people behind those numbers. So thank you again for the opportunity today to present. Basically what I want to do is talk about what our proposal is for 2024, 2025. Next slide, please. But as we prepare to talk about that, I also think it's important to highlight a few things about where we've been and where we've come from, especially due to the generosity of the council in awarding us the grant money last year. So next slide, please. So I want to capitalize and talk about the success that we've had since implementing the grant last year. Basically, our grant was to expand our unit in order to better serve the needs of the communities and the people in our communities. We were able to add the corporal position, and that's Corporal Fay, in April of 2023. We added 2 more deputies to the unit in May of 2023. And then we also fully implemented our data collection tool and dashboard system. Next slide, please. In addition to that, leveraging other braided funding and grants, we were able to add an additional clinician from Summit Stone to work with our team, which obviously is a vital part of co-responsing, having the clinician and the officer working together. And we're also able to add another supervisor position who actually supervises those additional clinicians. So in summary, we're able to add 2 more teams to our unit. So now we have a total of 5 teams that are working with our unit right now, including one team, which we call the Youth Crisis Response Team, that works specifically in Thompson School District. But we're now able to provide 16 hours of coverage, 8 a.m. in the morning until midnight every day. Next slide, please. In addition to that, we increased the percentage of mental health and substance use calls or related calls that we've responded to by the co-responder unit, in addition, or due to the addition and unit expansion that we're able to do. So in the past, prior to the grant, we were responding to about 28 to 30% of mental health or substance use calls. We increased that to 53.1% after adding the additional team members. And I'll talk a little bit more specifically about that in a slide later on. Next slide, please. So getting into our current grant proposal, basically what we want to do is just focus on that continuity of services that we've been able to provide. So we are asking for continued funding of those 2 additional deputy positions and the corporal position. That's our primary goal. But we've added some additional ones. One is to enhance crisis response through additional and specific training. Another is to continue to enhance our data collection and analysis. Next slide, please. The third goal that we've added is we really want to enhance and coordinate supervision of and coordination of both the school resource officer program and the co-responder unit. There is a lot of overlap since we're dealing with a lot of mental health issues within the schools and a lot of substance use issues in the schools. So we want to better coordinate between the 2 teams, which Corporal Fay and I both supervise, with a focus on kind of our common goals and projects. Some of the things we've done in the past, we want to continue with our coffee with a co-responder, coffee with an SRO. We want to do more with the State Attorney General's Office Connect Effect program. As far as education and awareness for all the youth in the communities of Laramie County. Next slide, please. I want to talk a little bit about some important considerations, and some of you that have been or heard my presentation, the mid-year report, this might be reminiscent, but really our partnership with Summit Stone Health Partners is crucial. We have a great partnership with them. They provide the crisis trained clinicians that we use to partner with our deputies to go to crisis intervention calls. Without that, we wouldn't be able to actually do co-response as it exists today. Also, for the deputies that work in this unit, we are not focused on enforcement. We're focused more on a community policing type of policing model, which we call problem-solving policing. And really, we try to bring together all the stakeholders in the community to try to help these people that are in crisis, because we know that mental health, substance use, co-occurring conditions are not just a law enforcement problem, that there's a lot of different stakeholders in the community that really have to work together to try to help these people get the help that they need when they're suffering in crisis. So one of our biggest goals is to keep people out of jail, especially for minor offenses, and for us to really problem solve that person, get them connected to services, and hopefully get them back in a place where they're stable and able to get on with their lives in a productive manner. The other thing we try to avoid is taking them immediately to the emergency department at the hospitals, because we know jail is probably the most expensive way to house somebody. We also know that taking them to the hospital is very expensive for either that person who's going, or if they don't have insurance, for the community at large to pay for all the tests and all the costs of going to an emergency room visit. So we really try to focus on trying to help that person, connect them with the resources they need at the time. And if we can, safety plan, so that person can stay with the family, stay with friends, and really stay out of the hospital, stay out of jail. A lot of the people we encounter with the co-responder unit, I would say a majority of them are dealing with co-occurring conditions. And when I talk about that, that's mental health issues and substance use issues. Many of the people that we talk to, and we're not like hard selling on this, but we think it's important to try to capture that data. But what we're finding is that a lot of people are a little bit reluctant to tell us completely about past or current substance use because they're afraid that we may be there to try to enforce that and try to charge them. Once we get kind of past that point and they realize that we're there to try to help them and try to help get the resources they need, they're a little more open, but we don't really force that information being reported back to us. But I can tell you a lot of people are struggling with both issues, and there is a correlation between that. We do crisis intervention. That's our main priority in what we do with our co-responder unit, but that doesn't mean that we go and talk to these people one time and then we're done. I think one of the things you probably saw in the presentation, in the PowerPoint presentation, one of the charts shows the amount of follow-up we do. We do a lot of follow-up to try to meet with those people after the crisis is over, to try to get them and make sure that they get the help that they need, try to connect them to those resources. And many times, the first time that we deal with those people, they're not always going to really understand how to make that connection. So we use our ability to do case follow-up and also our case managers that Sunstone provides for us to make sure that that connection actually occurs. In response to the previous discussion, I don't have zip codes here today, but I can tell you that we go to every corner of Larimer County, all 2,650 square miles. Wherever that call is, wherever that person in crisis is, that's where we go. So we've been everywhere from Kellam, some of you guys may not even know where Kellam is, to Glenhaven, from Poudre Canyon to Buckhorn Canyon, from Masonville to Red Feather Lakes. Wherever that call is, that's where we try to go and meet those people where they're at in the crisis, both figuratively and literally. We also work in the cities at time. Our youth crisis response team, which specifically works in the schools, majority of the contacts that they make and the people that the incidents they deal with are kids that are in the school system in Thompson School District. So a majority of those schools are in the city of Loveland. But we also work with our other responder partners, both at Loveland PD, Fort Collins Police Services, and Johnstown, to work together to coordinate our services. And then last, I'd just like to touch on the fact that our innovative approaches have been recognized nationally. Some of you guys may have read about one of our deputies, Cheryl Jacobs, who was recognized by USA Today as Colorado's representative in the Women of Distinction program that they honored people all across the country for the work that they do in their communities that make a difference. Deputy Jacobs was recognized for all the hard work that she's put into our co-responder unit and making sure that it started and has maintained since then. Additionally, many of our team members have presented at national conferences, including co-responder conference, where we also have some of our teams going in June to present. Also, the National Association of School Superintendents in San Diego asked for information and to talk about the YCRT team that we do have in the school district. So our innovative approaches have been recognized nationally. So I think that's a pretty strong argument for the work that we're doing is being recognized. Next slide, please. So you guys had a chance to obviously look at this. This is the budget worksheet. We're asking for $549,947 in total to continue the continuity of services that we're providing after we did the unit expansion last year. And I know you guys have had a chance to look at this, but we'll come back to questions in a minute. Next slide, please. when I talked earlier about the stats, one thing I wanted to highlight is that our unit works 16 hours a day. We have 7 deputies, including Corporal Fay and myself. And then we have our partner clinicians. And really comparing the 53% of the calls that we handle versus the rest of our patrol section, you can see here that our patrol section has 78 other deputies. We have 7, but we're still handling 53.1% of the calls versus 46.9. That's in a smaller time frame of 16 hours a day versus 24 hours a day. Next slide, please. This is the result of our data program that we've been able to put together, including data collection and entry, as well as dashboards. So I know you guys probably had a chance to look at that, but as I was talking earlier, a lot of what we do is the case follow-up, which is in the blue here. You can see about 24% of our calls are involving case follow-up. So next slide, please. In May 2023, we started trying to collect that data about substance use. And so since May, of the people that were voluntarily able to provide that information, we've had 275 contacts where people have said that either they're struggling with substance abuse now or they have in the past. And then you can see our top substances that are being reported are alcohol, meth, marijuana, and prescription medication. Next slide, please. This is just another version of that data collection dashboard. This is specifically for our youth crisis response team. Next slide. So that's pretty much the end of the presentation. I want to leave a few minutes for questions if you guys have questions. But I certainly want to thank you for the past support and continued support of our program, and we certainly appreciate it.
Wonderful presentation. You see Councilperson Black has her hand up.
Thank you, Mr. Chair. I appreciate that. Thank you so much for the presentation. You guys are doing amazing, amazing work. How are you not getting burnt out, or how are you taking care of that team's, their behavioral health?
So that's a good question. Thanks for that question. We do really focus on trying to support our people the best we can. I am an assistant coordinator for our agency's peer support team. And so peer support, people working with people that are going through difficult situations and sometimes very heavy and difficult calls. We make our peer support team available not only for our deputies, but also for our clinicians. And then I just found out that Summit Stone has also started a peer support team, and they've contracted with peer support to provide additional counseling and additional services. So we really focus on trying to take care of our people because, like you said, Councilmember Black, a lot of the work that we do is pretty heavy. And one of the other things we do is debriefings after most calls. We're able to kind of decompress and talk about the call. And then, like I said, we make our peer support teams available to both clinicians and deputies.
Fantastic. I'm grateful to hear that. I actually have a few questions, but some of these I probably will email you on. I know we're crunched on time, but one last thing, when you guys are working on safety plans before release, have there been many barriers for folks having a place to go or family feeling comfortable taking them with a safety plan? And I guess I'm just trying to figure out if you've had barriers with not being able to have a place, facility, say a bed or a place to take these folks, or if families refuse to take them back home. I just wondered what barriers you were finding while you did the safety plans with your patients.
Yeah, excellent question. We do sometimes struggle to find emergency housing. I think that's one of the biggest issues that we struggle with. But this community and the communities of Larimer County have really stepped up. So we have a multitude of different resources that we can tap into. So that's the nice thing about this area is people realize the importance of providing some of those services. I think we're still way behind, but I think we're moving in the right direction as a community. Some of the barriers we have are sometimes families as far as taking like family members back. Because I think they're afraid of what's going to happen when the person who may be kind of stabilized stops taking medications and kind of reverts back, or a person, stops their sobriety and starts using again. So I think those are all valid concerns, but one of the most job satisfying parts of what I get to do and what our teams get to do is see when someone does get that support, either from the community or from their family, how tremendous that is. And to see that person really go from someone who is completely dysfunctional to not actually function in society to someone who gets a job, somebody who stays sober, somebody who's taken their medications. And occasionally we do hear some of that good news. So that definitely helps keep us going.
Thank you so much.
Another question to the proposal.
Yeah, I just, in reading some of the information, I think it's worth noting, you said the carryover, that, was there was due to vehicle, portion of it. But I also see in reading, there was one deputy position that was filled in May, but then, and then left in August and then not filled to December. So I'm assuming that's, and I wanted to make sure, assuming that's correct, that some of those funds for that employee and their benefits should be in that amount as well. Is that correct?
Yeah, so part of the reason why we can't instantly transfer somebody into that position when somebody leaves is because we want to have the best person available. And so we want to select somebody who has the prior experience and the knowledge and also the commitment, because this is a difficult job. So, and we do ask a lot of our employees. So some of the money that we're asking to carry over is money that's been encumbered to purchase those vehicles. But unfortunately, due to supply and demand and going back to COVID, as well as the United Auto Workers strike that happened last year, that's prevented these vehicles from being delivered when they're supposed to be. So, so there is some money left over. The other part I would say is that last year, in order to completely fund those 3 positions, the total cost was $663,000. We asked the council for $550,000 and we received that. The other amount came from Laramie County funds.
Right. Yeah, I understand that. And it does take a special person to fill those positions, but in that vacancy, there should have been some funds that weren't used then for that employee. So I'm just assuming that those are still carried over as well.
Yes.
Thank you.
Great question. Any other questions?
I'll make a motion to approve, this, the Larimer County Sheriff Co-Responder 2024 funding proposal.
Second?
Motion and a second. Any further conversation? Hearing none. We'll move to the motion. All those in favor, signal by aye.
Aye.
Any opposed? Hearing none, that passes unanimously. Thank you for your service and work. It's great to get it up over 50%. That's a drastic improvement. You should be proud.
Thank
And I
you.
really appreciate your data. That's just fantastic.
Absolutely. Thank you for the support. We really appreciate that.
Thank you, Sergeant. Thank you, Undersheriff.
Yes. Oh. Okay, moving along, we've got Rise Above Colorado State University's Prevention Research Center, school-based prevention proposal. You're up.
Yes.
Hi, everyone. Thanks so much for your time and the opportunity to present today. My name is Kent McLennan. I'm the Executive Director for Rise Above Colorado. We are a statewide substance use prevention organization. We work with communities across Colorado, working with youth 12-17. And so we're really excited to have this opportunity, not only to partner with CSU Prevention Research Center and Dr. Nate Riggs, but also with your community and your schools and youth potentially to work together on a youth prevention project here in Larimer County that really builds on some of the existing efforts that you already are supporting in this community. So we'll jump into it and go a little bit deeper as we go. So next slide. So the proposal that we've put forward to you is for $100,000, and it is in the prevention area. And again, as I said, building on the CSU Prevention Research Center initiative. really by deploying evidence-based universal prevention strategies. And so really working with approaches that have a history of success, both locally and nationwide. And we'll talk a little bit more about what those are with our time today. And our goal is to not only reach a broad spectrum of youth with prevention materials and resources that helps them make healthier decisions because we increase their knowledge and skills through the presentations and outreach that we do, but also giving us a chance to support specific youth that have already been designated through the CSU work that is happening currently. And so we'll talk about that as well. So first and foremost, we're going to talk about how we would work with a subcontractor of ours, which is SC2 Communications, around a localization of the Connect Effect campaign. Sergeant referenced the Connect Effect campaign earlier, and so we'll talk about opportunities to localize that in Larimer County. Right now, it's a statewide messaging campaign that comes out of the Attorney General's office. And so we'll talk about how that will be different and what we can do differently here. And then in addition, our goal is to really work with the PRC around the 3 school districts that are identified and specific youth in those districts and those target audiences to go a little deeper and dig deeper with some of these prevention resources and programming that then they can help offer back to their own student bodies and to their communities, their school communities. So next slide. All right, so just to back up a little bit, just to make sure that we're level setting with the Connect Effect campaign. So this is a statewide initiative that was launched by the AG's office. Rice Bowl, Colorado was able to subcontract on the creation of this campaign with SC2 Communications, the firm that I just mentioned. So this would be there would be consistency in terms of sort of the look and feel and the approach to this effort. It launched in August at a statewide level. But I will tell you, as you know, most of the funds for opioid abatement are going out to communities and not a lot of it staying with the Attorney General's office. So the funds that are available for statewide messaging around this particular public awareness campaign are relatively limited in terms of its ability to actually reach youth with a frequency that is really required in order to create behavior change. And so that is why we've been talking with a number of different ROACs like yours about the opportunity to dig deeper, to localize that messaging so that it's not just talking about Colorado youth, it's talking about Larimer County youth. So next slide. This is an example of the creative. If you haven't seen it, it does come in English and Spanish with different materials. We will be updating some of this content this year as well. But this is just a sample of some of the messaging. It does use a social norming approach, which is one that Rice Bowl, Colorado has been using for 7+ years now. That's an evidence-based approach and strategy in prevention that really focuses on data to be able to really change the perception of reality for young people and for adults. And it really debunks that mentality that everybody's using, right? Because the data would tell us that that's not the case. And so that's one of the things that we're trying to showcase, whether it's about use or whether it's about, in this particular case, bystander behavior, where youth are more than a vast majority of them want to help a friend and support a friend and keep them from misusing a pill that could be laced with fentanyl. Next slide. So this campaign, what we would propose to do would be to work with you all and with youth in this community to localize this messaging. So it's taking the shell of the existing campaign. So we're doing it efficiently and not having to repeat the costs of doing all the research and all the design work, taking that same shell, but being able to localize it in ways that are meaningful for youth so that we ensure that it's Larimer youth that are having input on the message. The data points that we'll collect will be Larimer County data that would be showcased in this, whether that's from Healthy Kids Colorado or from a survey that we commission as well, which I'll talk about in a second. And so it's using that local data to be able to change that messaging, change the look and feel, so we ensure that it looks like Larimer County and that youth are seeing that Larimer County mentioned in the advertising that is being delivered via social media primarily, but also through posters and in-school communications, and like the posters we saw. So really, it's our chance to come into the community and take a shell of what we have, but listen of what really needs to to be emphasized, how we hear from local youth as to the creation of those messaging pieces, and then what the call to action is.
Would that include listening to already youth coalitions? We have 4 of them throughout the county.
Yes.
That you could go to the coalition meeting and get information directly from them.
Yes, yeah, so we can do that in both formal and informal ways. We've got budgeted already for a couple of formal focus groups, but we would also be doing some of this listening and can do that at those 4 locations. Yes.
Thank you, Mr. Chair. And so, you know, this council, we've been, the 3 of us have been at the statewide conferences coming here, in the fall. And so, due to Sergeant Cook and his team's great work, we're probably the only region that got the posters to every, middle and high school in the county. And that's, so I was hoping, and we're also going to be talking about the grant that is out from the COAG to help with that as well. And I'm wondering, since they've already been doing this work in the schools and they have this crisis intervention.
Youth crisis response team.
Yes, sorry, too many acronyms today. I'm wondering, because I don't want to have like silos or having duplicative work, would you be looking to partner with these wonderful folks who are already in the schools and doing some of this work, and they really have been getting the connected facts out and the posters and kind of informing the schools of that work. Because I actually heard from the superintendents from those schools, they were grateful for the work with CSU. They were really complimentary about that work. So I would like to see that it's not duplicative, but collaborative and maybe working. And so would that be something you would be looking to do? Because also they've been doing social and things like that.
Yeah, absolutely. We would love to have the opportunity to partner with you all, and the resources that you've already established. We're built on partnerships. We're a relatively small organization. So we rely on boots on the ground and the folks that are that know their communities, that know the connections, where we can bring in some additional resources and TA and training and materials, but building on those things that already exist. That's why, you know, we were excited to work with the CSU team on this, because of what they'd already established in some of the schools and where they were hearing the receptivity to add something more. And I'll talk a little bit about the content that layers on in addition to the actual Connect Effect campaign. So we will jump to the next slide. So the outreach that we talked about is being able to support it. And maybe you can just remind folks that in the 3 districts, we talked about some specific audiences that we would be working with when we go a little bit deeper, and where you see some of these last bullet points.
Yeah, so in year 2 of our work, we've been able to go from a kind of a scheme.
Sorry, can you come so we can?
Yeah, sure. Yeah, and pardon my voice, I'm a little, getting over a little bit of a cold, but, so what we've been able to do in year 1 was really take a county-wide approach. It was pretty standardized across the 3 school districts. Now that we know the school districts, there's a lot of trust between the PRC and school districts. We've learned a lot about specific populations of youth that those school districts are wanting to focus on in year 2. So I'll just give one example. And the one example is in Poudre School District. They really want to focus content on their LGBTQI identifying youth. And so the idea would be for Kent and Rise to be able to leverage that interest and be able to identify or develop content campaigns specifically for that population of young people. So, yeah.
Yeah, so hopefully that gives you a flavor of what we're planning. So in terms of the resources that are available that we would bring in terms of training both staff and doing the delivery ourselves, but also training staff to allow for some sustainability in the schools. At middle school and high school, both, we have the opportunity to deploy our not prescribed lesson that gets used by more than 10,000 youth every year across the state through educators as well as ourselves. And it is a lesson specifically about prescription drug misuse, which also ties into brain science and adolescent brain development, as well as we've added a section about overdose and fentanyl specific content on here. So that's a new module that's specific to the fentanyl crisis that we're facing. So that is something that's an hour-long lesson. It also has great results in terms of increase of knowledge base and increasing the perception of risk of trying and experimenting with prescription medication. So happy to share some of those data points as well. That'd be one piece. We talked about just continuing to deploy the Connect Effect posters if that were needed. If it's not, we'll certainly defer on that one as well. We do a data discussion around closing the gap that is really aligning perception with reality in terms of those data numbers like the poster I showed. I'll show you a quick slide on that to come as well. And then doing some action with that, taking the data that we're teaching you and giving some of these small groups of youth the opportunity to then put it into their own words through what we call a community activated design poster making workshop, where they will create their own art installations in their communities and schools that can be displayed for larger student body. And that would be an opportunity, again, to really engage those youth in the messaging that they own, rather than just something that's being fed to them. So that'll be part of that. And then we also are trained in naloxone, and I would be happy to do naloxone training if and where it were of interest in school communities or outside that setting. Next slide. So this is a quick snapshot because I know we're getting close to time, but this is the not prescribed lesson. It's free for educators to use. We train educators on it regularly, again, because we want to see them be able to use it year over year in terms of the content that they're able to deliver. Next slide. And I mentioned just this notion of closing the gap, of closing that perception with reality. And so you'll see illustrated here based on this data, the number of youth that are actually using a substance. So let's take prescription stimulants at the bottom. We're in middle school or age 5% are actually misusing a prescription stimulant, but the perception is that 21% are. If we can close that gap, that's part of the science of that gap comes closer together. You have a more accurate perception of reality. You're less likely to use yourself. Next slide. And I mentioned the poster making workshops. We've done this in a number of communities with our youth around the state, and that opportunity to showcase some of the messages and that positivity, as well as some of those data points that they can share with their peers and get conversation going. Next. As I mentioned, evaluation is a big part of the work that we do. We'll have media campaign reporting to be able to report on a regular basis on the campaign as it's once it's live and running, which is estimated for about a 5-month run based on this budget. Once we've done all the work and the listening we talked about, we are going to oversample. We're proposing to oversample Larimer County with our Rise Above Colorado Youth Survey. That is a separate survey from Healthy Kids Colorado. For those of you that are familiar with that data, it goes into much more detail around substance use, attitudes, and behaviors. And so it gives us some additional data points, specifically around fentanyl, that we can utilize if we oversample in Larimer County, that could be utilized as part of that localized connect effect. So that would be a component of this, as well as being able to report specifically on the not prescribed lessons that are delivered here and what we're seeing in terms of changes around knowledge and perception of risk, as an example. So that's some of the evaluation pieces. I'll leave it there, and I think next slide is questions.
Yeah.
No, go ahead.
Just real quick, I think this is great. You know, I was gonna bring it to the council today. I think we all received an email from me, but thank you for not replying all. But the Colorado Attorney General's office is actually doing a little mini grant for regions to be having the connect effect, and we were gonna have since Sergeant Cook and his team were pretty much the ones that got these out in every corner in the state. So I wanted to make sure how that would overlap, because I sound like that's what you're also doing, but we're trying to, you know, take advantage of that little mini grant as well. So do you see a partnership or collaboration there?
Yes, absolutely. And again, that's one of those pieces that would be a fairly minor piece. Well, we'd have the things at the ready if they're needed, but if they're being deployed elsewhere. And again, the coordination of the work that we're doing in common locations, I think we'd absolutely want to do that.
Okay, thank you.
Thank you. Sure. Thank you for the presentation. I love that it's very opioid specific, not exclusively. And it sounds like you have some metrics, data collection, things in place. So you're able to kind of measure the difference in uptake between statewide and localized.
Right.
That's fantastic. Have you guys considered getting into the Boys and Girls Clubs in Larimer County.
Yeah, it's a great point. Again, I mentioned we're all about partnerships. We partner with a number of Boys and Girls Clubs around the state. We actually know their former executive director and have worked with the clubs. And so, yes, that it would be a great opportunity for us to extend even beyond this grant. And I think we may have some other opportunities through other funding sources of our own to be able to do some of that additional work with Larimer County Boys and Girls Club, because it's right. This is right in our wheelhouse. We just did a training for staff that I believe the Larimer County program staff were part of, to train around not prescribed and closing the gap, so that they have those tools and we'll help support them for that.
Fantastic. I know Sarah McKee, the local.
Yeah, again, that we welcome those collaborations.
Thank you.
Yes. Great source.
Any other further questions? I just want to make a comment from a public health perspective, the youth work, the prevention work, that's upstream. That's where we really want to, with those social determinants of health. So I like the campaign. I think it's absolutely should just. Thank you.
Thank you.
Thank you. I think it's great. I think anytime we get upstream, it's really important. Also, just appreciate the work that we have in place that you're going to accelerate that. I think I'm assuming you're talking about Casey, and I appreciate that partnership because I know she's able to connect all those dots. So I think we want to make sure that we're reaching all youth and how we can do that. And so also want to make sure we understand about some of the rural schools in Estes Park and making sure that strong connection up there, and because those are really important communities that sometimes are further out, but still with 4.5 million people coming through there, I always wonder what kind of things also are coming through there. So I think it's it's anything we can do to help our youth in our early intervention and access and prevention is really tremendous benefits for our community. So.
Make a motion on anything here?
I don't have any, but I would love to make a motion to grant the $100,000, approve the $100,000 to Rise Above Colorado.
I'll second.
We have a motion and a second. Any further conversation? Hearing none. All those in favor of the motion?
Aye.
Anybody opposed? That passes unanimously. Thank you.
Thank you.
Thank you all. Appreciate it.
All right, moving along. We're on item 7, Lighthouse Faith-Based Sober Living. This is one of those situations. Back in November, we emailed several folks that were doing work through the impact dollars for behavioral health services and regarding sober living. That email got missed and found and contacted us. So we thought, well, bring you here, and here's your opportunity to show us some of the work you're doing and some of the gaps that you may have. So I'll turn it over to you.
Thank you, Mr. Chairman and Council, for allowing me to come a couple months later than we were originally invited. My name is Chrissy. I'm the director of Lighthouse. I've been with Lighthouse 10 years, and I just wanted to, I put this together really quickly. So we are the biggest and oldest recovery community in Northern Colorado. We were established in 2010 by a man named Rick Hatfield. So I did not found the organization. However, been on board since 2010. So I've gotten to see a lot of stuff. So we originally began in what was called the Spady House. I'm sure some of you are familiar with that location. That house has a stigma associated with it here in Fort Collins. But we operated out of the Samantha Spady House, the house on Wagner Drive, for over 13 years. We were very blessed and fortunate to have a low-cost lease for that entire time, and we're able to maintain that. Since then, the fraternity has reestablished and took back over the house. So we just recently found a new location in Fort Collins in Old Town. Our mission, you can go to the next slide. Our mission is really simple. It's just to help addicts get sober for life. How do you do this? We start with the first things first. We provide stable, sober housing, food, and utilities. These are things that we all know, basic human dignities that are often lost during active addiction. And so without these things, where you take a shower, where you're getting your next meal, you can't really think ahead to step two of getting a job or things like that. So this is number one. Number two, we provide structure and accountability. Three, we show participants unconditional love and acceptance. This is huge to us. And four goes hand in hand. We endeavor to make participants feel like they're part of a big family. Next slide. So the first thing, stable, sober housing and food, that's an absolute necessity to help someone get sober for life. We offer probably more than a lot of sober recovery communities in the area offer. We have housing. Our main house has shared rooms. They get a bed, dresser, desk, shared closet. I'm going to go through real quickly because I know we're on a time crunch. We're the only sober living to offer food. We have an agency contract with the Larimer County Food Bank. So once a week, we send a crew down to pick up food. We stock our kitchen with food so the guys can prepare their own meals as they wish. We have so much food. You know, when you go to college, they call it the freshman 15. We have the Lighthouse 15 people game too. So anyway, we get weekly donations straight from Sprouts. That is a collaboration with the Larimer County Food Bank. But we do pick up directly from there on Sunday morning. So we have an amazing amount of food, basic utilities, cleaning supplies. We do have free laundry, including the detergent. When people move in, we provide them with fresh bedding, towel and washcloth, a brand new pillow, laundry basket and hangers. Some of the things we noticed when I first started working there, their clothes are on the floor because there's no hangers, you know. So just basics. We also have a donation closet with clothing, as well as personal care items, so that within the first 24 hours, people can actually take a shower, brush their teeth, that sort of thing, if they're coming from the streets. We have Chromebooks available for people to use to apply for jobs, to create resumes, and we actually assist them with that sort of thing. As far as our areas of accountability, we have 6 main areas, first of which is sobriety. Obviously, we're sober living. That is a necessity. We do drug testing in the form of urine analysis, breath analysis, oral swabs. Obviously necessary to keep the environment free of triggers. People don't come to us because they can handle being around drug and alcohol consumption. So it's really important. We're the only sober living to use the same lab that the judicial system uses as far as like the testing of the urine samples. It does like really ensure the integrity of the test results. As far as the second area of accountability, recovery support meeting attendance, that is meetings of their choice. While we do offer in-house meetings every day of the week, people who come into the program can decide, does AA speak to me? Do I need counseling? Am I in part of an IOP program with North Point or Mountain Crest that I'm going to attend while I live at Lighthouse? So we do require and hold them accountable for attending recovery support each week. However, they can decide which ones they want to go to. Curfew obviously helps with healthy boundaries. As far as a job search, we've created what we call our job search action plan. It's a step-by-step plan they can go through that, you know, number one, create a resume or write down all your work histories. We have a plan that walks them step-by-step on how to get a job. And we hold them accountable for doing that and for making daily job contacts if they enter the program without employment. Everyone has a chore. It's a win-win. They get to build some life skills. We don't have to pay maid service. They keep the house clean. Payment and monthly fees, obviously, operating the program isn't free. However, we have noticed a greater level of success when people have skin in the game. We do have scholarships available for first month, full scholarships at the moment, because there are barriers that first month, but it's really important that they start paying something. So we do hold them accountable for payment and monthly fees. The third thing that we offer, the unconditional love and acceptance. To me, this is one of the biggest things that we offer. We all know addiction doesn't discriminate. I mean, we have people come to us from every demographic. We've got people that come from the shelter, from jail, from prison, from the halfway house. We also have people that show up from high-dollar treatment centers and have wealthy families of means. But then We have people from every ethnic group come to us. We have people from every religious background. We have pastors' children coming, entering the program. The type of people we serve is really vast and varied. But the one thing really everyone has in common, the shared thing, is they all need love, the basic human love. And so the people that show up, by the time they get to us, they're hurting, lonely, they hit rock bottom, they're full of shame. They want to exit this lifestyle and don't know how, you know. Often they have negative thought patterns that they've developed about themselves. And so our goal is to help them replace those negative thought patterns with new positive thoughts about themselves and instill hope that they can change, that they can have a better future. Our strategy to do that is very simple. We provide this unconditional love and acceptance. We treat them as valuable human beings. We don't look at them as a product of the past. We're not talking about their criminal history all day long and what you did and shoulda, coulda, woulda. It's all about seeing their potential, seeing what makes them valuable and trying to convey that to them, you know, on a one-on-one basis. So unconditional love and acceptance really can change everything. I think we all know that. If we take just a pause, we can think back, high school or middle school, you had that special teacher, you had that special coach who saw you and really encouraged you, that expressed value maybe at a time that you were struggling. And we know that can really change the trajectory of someone's life when they have someone believe in them.
My sincere apologies. We got to wrap it up in 2 minutes.
Okay, next slide. We also welcome them into the family. We have multiple ways that we do this. We have a staff, we have, peer support, peer leadership opportunities within the environment to build connections, huge holiday celebrations. We do Christmas like we do it at my house. Ultimately, no one can do it alone. We truly believe no one can really leave the old toxic relationships until they build healthy, new, sober connections and relationships. So our main house is a dorm style environment. It's a large environment. We have 4 step-down phases, and our current fee structure is $850 the first month, $750 thereafter. Affordability is a huge priority for us. We don't have a maximum stay, as we have really observed a direct correlation between the length of stay and long-term sobriety. And next slide. We have, in an organic way, we birthed a graduate house model where we have now opened 3 graduate houses. They're peer run, but they're staff supported. So they're much like the Oxford House model, but with an umbrella of staff, not on that site, but we're there as needed. And so you can see what we do here. Graduate house residents are absolutely welcome at all the activities of the main house. We do have staff, peer leadership, peer support specialists, and many volunteers. And then we'll go to the next slide, our faith. We are a faith-based organization. We believe that we are mental, emotional, physical, and spiritual beings, and that we should address all of these facets, especially in recovery. Several of our in-house meetings are from a Christian perspective. It's not required. Ultimately, we embrace people of all faiths. You don't have to sign a statement of faith. You don't have to convert, and nor do we pressure anyone to do so. We just welcome everybody. I wanted to end, Mr. Chair, you had asked me to bring some numbers about what it would cost us to expand into the southern area, into Loveland or Berthoud. We currently lease all 4 of our houses, so home ownership is a huge thing for us. We would actually like to reduce our prices. We see the sober living costs in the area skyrocketing because housing is skyrocketing. So we see homeownership as a dire necessity for anyone for long-term sustainability and affordability. Ultimately, I don't have a slide for it, but ultimately, in order to lease another building, which is not our goal, but it would be a good interim solution in the southern area, Loveland or Berthoud. It would cost us about $100,000 to do a startup, to get into a building, to get established, to furnish it, all the things needed. And then to purchase, we would need about 250 to 350,000. In today's market, the banks are requiring nonprofits to have a 50% down payment for a building. And that would be a much more sustainable long-term solution for us. So thank you so much.
Questions?
Do you have, what other sources do you, grants, what avenues do you
Yeah.
also pursue?
So we just started pursuing grants in the last year because we were at the building. It's a very low cost lease. We hadn't really spread our wings into fundraising and grant acquisition. So we do have a grant from the county right now. They provide our first month scholarships through the impact grant. They provide our first month scholarships as well as have funded our peer support program that's in-house. We do have some donors, we're just building a donor base. And we've gotten some small grants through some local churches and whatnot. And the schools will be applying for the next grant program through the Bohemian Foundation does, and we've already received one of those with some more in the works that are.
What percentage do you see, is your occupancy in the, not the graduate houses, but the main house?
When you say percentage, you
Of
mean?
occupancy,
Are
are
we
you full all the
yes.
time? Is there a waiting list?
Yeah, we're full. Our graduate houses actually have some statistics. Our graduate house statistics are pretty amazing. Our success rate, we call success rate, people moving out into permanent sober housing, a success, is about 80% across the board. But in our grad houses, when I talked about length of stay, our first grad house we opened in May of 2018. It's a 6-bedroom house. Those houses are single occupancy bedrooms. It's more like just a normal residence for people, but they live together in community. We've only had 27 people over 6 years in a 6-bedroom house. The current residents, their total length of stay, now that includes the time in the main house, is 55 months, which is amazing. They really get to feel like a family. We see value in people being able to stay as long as they want to, and to offer really a permanent sober housing solution for them, as well as the transitional meals.
One question, I do one more question.
Yeah.
I see Councilperson Black's hand up.
Thank you. Appreciate that, Mr. Chair. Do you allow residents to take medications such as antidepressants, antipsychotics?
Yes.
Yes. Okay. Thank you very much.
Mr. Chair, if I may very quickly.
Yes.
Thank you. It's good to see you. I'm a resident and alum of the Lighthouse, so I can vouch for everything that was just presented. That place saved my life and changed my life. I very much appreciate that you are faith-based but not faith-centric, that there's no requirement, but that is there. Fantastic service and training. I really appreciate it.
Further.
I was just wondering, I've known of the Lighthouse too, but is a faith-based organization overseeing you or no?
No, we are a standalone 501c3. Yeah.
Thank you.
Yeah.
Wonderful. Great work you're doing. Thank you.
Thank you.
Just perfect. Wonderful. Thank you.
Thank you for the opportunity.
Well, thank
Thank
you.
you.
Yes.
Okay, moving to item 8, Harvest Farm Housing Proposal Follow-up. I'll turn it over to you.
Yeah, so I think the follow-up question was really centering around our septic system and structure. And I appreciate you bringing that up. But after looking into it and having our engineer look at it and work with your team, we did find that we would not have to pursue a state application in order to upgrade our septic system, which would then allow us to pursue underneath the proposed budget that we present to the council.
That's correct. I got that from my team. So. Yes, ma'am.
I think I had also just wanted to, I don't know if your team got the answer back, but I had, and been on the call with, the Colorado Attorney General's office, because my question was, with the scrutiny of funds from the things, putting money into the septic tank was, a gray area and something just to consider, whether or not, you know, if it was for expansion, I'm just saying that that was just a heads up that that was for them to say they were improving the septic tank was an area of, it might draw some attention, but it was a gray area, and I just feel like since I had that conversation, I should let the rest of the council.
And Liv did email their response was a little different, wasn't it?
Yeah, it was, that was the.
Okay, well, I'm saying, I think that's why I wanted to do that thing, because I talked to someone at the top and they said, I think your staff will look into it and get back to you. So I'm glad, that's why I asked if you got an email, so that's great to hear. I just want to make sure we had
Oh, that's good.
closed that question there.
That's an important question. Two questions.
Are we gonna take, do you want a motion then to approve? The
That's
rest
the
of
council's desire, yes.
Go ahead, do you have a question or?
I would like to make the motion, but if you.
Go right ahead. I don't want to take your tender.
I'd like to make a motion to approve the contract proposal with Harvest Farm for the amount that was requested, so including the septic system.
Second?
That's a motion and a second. Any further conversation? Yes.
I just want to make a point. I think the service provided by Harvest Farm, one of the distinguishing points of it is that it's a full live-in, non-cost bearing, but they work with people. So they don't have to pay rent, but they work with people to every month that they can save so that they're able to self-sustain once they leave. And I think that's an important kind of different aspect of that program that I think right now is the only model that's offering that I'm aware of. So I think and being able to increase the amount of beds there and the ability for people to get connected into Harvest Farm is worth our funding to go to. So I just want to make that comment.
I just wanted to know that, again, I apologize, I have lots of contracts in my head. Are we making sure the funding is going mostly for Larimer County residents, or is this money going to be able to use for other folks that come from other jurisdictions? And I'm wondering if we'd ever kind of specify making sure it's for, the money is going to help that expansion for Larimer County.
Sure, that's a great question. So with us, we do track zip codes with everyone who comes in, and we have so for years. And the vast majority of individuals we serve list Larimer County as their last address. Now, for individuals experiencing homelessness, that doesn't mean they had a physical address, but that is what they list as their last known address when they come to us.
Thank you.
Yeah, you're very welcome.
Any further comment, question? All right, we've got a motion and a second. All those in favor of the motion, signal by aye.
Aye.
Anybody opposed? Hearing none, that passes unanimously.
Thank you guys very much. I appreciate
All
it.
right. Now, last item, real briefly, we did an evaluation subcommittee. Our vice chair's done lots of work, and Laura Walker as well as some staff looking and have an opportunity to see evaluation. What would that mean? We want to make sure we're not duplicating anything, but complementing anything. So there'll be a proposal.
Yes.
Turn that over to you.
Thank you, Mr. Chair. And I know we're out of time, and Beth and I have to be somewhere right now. So I'll do this really quick. So if we have further questions, we can revisit this if you have questions. But Trustee Mason and Beth and I and Dr. Jared Olson and some of our folks from the Sheriff's Office and Fort Collins Police and others, and I believe it was some folks from our behavioral services have been meeting with our subcommittees. You know, we're trying to get that dashboard and get that up and running, and we and that because we've had Larimer County person has gotten a great opportunity to move on. We have a little bit of like that is coming, and but we also noticed in and MJ Jorgensen, they alerted us that there might be some duplication from the NSCH, and that we didn't maybe catch in the documents that they are also contracting, that maybe it was more expanding into looking at all of the framework. And so, we've been having some conversations, I have been having conversations with Laura Walker and, with Dr. Olson and stuff, and we feel that maybe we can have, transfer those efforts and combine them with our data subgroup and have that facilitated by Dr. Jared Olson, because he already has the contracts with these agencies, for data sharing. And so we thought that might help, help with the expedition of this and also the partnership with, MJ and their, and NCHA, sorry, my brain's going in. Sorry, I'm trying to like, we gotta go. And so we want to do that kind, but still all this activity would be under the direction of the ROC and to the subcommittee. And we feel like this might be a good way for us to work together and collaborate, could be, and also I'm on the state subcommittee, and I'd like to come and show you the dashboards. And we're looking at also the national ones to John Hopkins, and I'd love to have some time next time to bring you up to speed on that. So I'd just like to maybe have a motion for us to take some of that out of the scope from the NSA, just to have kind of a motion to direct the data subcommittee to continue this work by combining with that work with Butler to have under direction of Jared Olson to be under our data subcommittee. And that would kind of change a little bit of that, a tweak a little bit on that.
Part of our scope includes a heavy working group and would address a lot of the things that you're talking about. And Cubby actually is with Butler, would be the person to support that.
So I feel like it's the best, good way for us to work together and amplify our work and elevate our work together. So I just wanted to have a motion. I would welcome, I would like to make a motion to go forward in that direction and have Dr. Garrels and facilitate that and work with the data subcommittee, which will be meeting together soon. So.
Second.
Got a motion and a second, just for clarification. Dr. Jared Olson is our population epidemiology at the health department, so that's his role, so it's great for him as well, and his job duties. Any further conversation on it? Did you get that motion? She's got it written down for us.
Well, yeah.
Any further conversation? Yes.
Sorry, I have to talk about the practical things. Are we talking about amending a existing grant agreement, and what dollar amount are we talking about?
I don't think it's changing the amount or the agreement. I just think we're kind of saying that we're gonna kind of just the same work, but it's just gonna be combining it with the data subcommittee and Dr. Jared Wilson.
Oh, okay, great, thanks.
It's more of a bullet point than a contract change.
Yeah.
Okay.
Any further questions, conversation? Hearing none, all those in favor of the motion?
Aye.
Aye.
Is anybody opposed? Hearing none, that passes unanimously. Yes.
Real quick, Mr. Chair, as you all got an email from me, we were at the COAG Learning Forum, and there's an opportunity for the regions to apply, which is already past the deadline, but for that $1,500 through the do social media and get the Connect effect out. And it was already work that Sergeant Cook had been doing all last year. It's kind of an incentive for other regions to do the same work that he's been doing. And I just felt that it was an opportunity for us to get, even if it's a small amount of money, and we're the fiscal agent. So we went ahead and got it started because there was a deadline of March 15th. I just need to see if we can quickly have a motion today, sir, just to kind of have our stamp of approval. And I had already talked to the Attorney General's office about this. They thought it would be fine since we're the fiscal agent, and Sergeant Cook and his team started filling out the paperwork. So I just wanted to see if we could have, I know it's not on the agenda, but I was hoping we could maybe make a motion to approve that, going for that Connect Effective grant, grant for $1,500, and to have the co-responder, Sergeant Cook, through the schools, to the Connect Effect to follow that. It's basically getting social media. I think I passed it all out to you. So if you have any questions, but I would like to make that motion.
Second.
Motion is second. Further conversation? Hearing none, all those in favor?
Aye.
Aye.
Is anyone opposed? Hearing none, that passes unanimously. I'll entertain a motion to adjourn.
One other quick piece. September 30th, the Attorney General's office, my friend Attorney General Phil Weiser is bringing the statewide conference here to Larimer County, to Loveland on September 30th. Please mark the calendars. because as a region will be involved and get to showcase some of our work. And nationally, the National Association of Counties and I think NIH is showcasing Colorado and our way of how we've done our regional approach and giving money out is going to be showcased, and there'll be some information and media coming out, and I just want to let you all know about that too. Thank you very much.
Monday.
Yeah, and followed up by rethinking addiction the next day.
Oh,
Same spot.
nice. That's great. That's a good.
Very on purpose.
Yeah. Adjourn. Anybody opposed? We're done.
Hey,
Good work, everyone.
that was a lot.
We're